really the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hey everybody, Dr. Natalie Keith here.
And Dr. Tracy Trussell.
And this is Vet Tales. We're ready for a whole different topic today. It's still kind of in your wheelhouse, though.
It is. Today we're going to be talking about the brachiocephalic dogs.
Yes, or the squishy-faced.
Or the squish-faced dogs, or the Snorter Dwarfs, or the dogs that run the 30-yard dash, or 40-yard dash in the 30-yard room. However you want to call them. Brachiocephalic is the proper name.
Yes.
But it's the smush-faced dogs.
The smush-faced dogs with the big eyes.
Your pugs, your French bulldogs, some of your Boston terriers, English bulldogs, things like that.
Even the Cavalier is.
Even the Cavalier.
Yeah, they're not as squish-faced, but.
Not as squish-faced. Not as common as some of the others. So a lot of your articles and stuff won't have them listed, unfortunately. Yeah. Because they do fall into that.
Yeah.
So.
Okay. Yeah, they're a very popular group of dogs.
Yes, they are.
Yeah. And they're super cute, and I get it. But they do come with their own unique set of veterinary problems.
They do come with their issues.
Yeah. Not all of them limited to their face.
No.
Interestingly enough.
A lot of them are related to their face.
A lot of them.
And probably their biggest issue that they have is their airways.
Yeah.
And that's what we see the most, or I see the most issues with, and I can correct the most, is they will have a couple of different things that we'll see pretty routinely. We'll start at the front. Their nares, their little nose holes, a lot of times because they're smushed, they still have the same amount of tissue in there in a smaller area, so their nose holes aren't as open as they should be. So they can't get as much air from the outside world. So which is why you'll see a lot of those dogs, if we haven't tried to correct that or gotten that corrected as best we can, they'll sit there as they're breathing, they'll be open mouth breathing.
Yeah, or whistle when they breathe.
Yeah. We
call that stenotic nares is the fancy word for that, which means tiny opening of the nostril hole.
Yes.
Yeah. Which is an easy fix for you.
It's a pretty easy fix in there, as long as it doesn't go too far up into the nose of closing it off. And most of the time it doesn't. Probably 98% of the time it doesn't go much further than the very front.
And at least fixing the front helps.
Yes. Yeah.
It gives more space for the air to move. It's like drinking through a bigger straw.
Yes.
Pretty much.
Yeah.
Yeah, you don't want to drink through a coffee straw.
No.
You can if you have to, but you don't want to.
Yeah. I mean,
you want a smoothie straw.
Yeah, your Route 44 Sonic, you can drink through a coffee straw, but it's going to take you a minute.
Yeah. Yeah, and it's a lot. I think I like to talk about straws a lot with this because it's also creating all that negative pressure. Think about how hard you have to suck on that straw to get things to come up. Or if you have like a normal Sonic straw in a milkshake at Brahms, and the milkshake's still pretty ice creamy, you're gonna have to really, your cheeks are gonna hurt before that's all over with.
They are. Sometimes you'll close that straw off.
Yeah, you just pinch the whole straw in two.
And the nose will do the same thing.
Yep.
You get them negative pressure, it'll close off.
Yeah. Yes, negative pressure.
Not permanently, but
but while the inhalation is happening, it can sometimes just pinch off the airway.
Yeah, it can actually just shut down air movement.
Yeah, which could dabble a little bit into the trachea as well, depending on the dog. Which that doesn't necessarily confine itself to the smush face dogs, but
no.
But certainly that can happen anywhere along an airway.
Yeah, it can. The next part, which I think probably will allude to more of the negative pressure issues as we move further down the airway, is their soft palate.
Oh yeah.
The soft palate will get long. It's, if you look inside the dog's mouth, in between the teeth, the little ridged parts you'll see in the front, that's their hard palate. Right behind that's their soft palate. It's supposed to stay in there to try to help keep the airways open, so when we're just sitting here resting, we can have air go in and out the nose, no issues.
Kind of keeps things going in the right direction.
Yeah.
It's like a little funnel.
And then as we're eating, helps kind of shut everything off so that the food goes down the right spot.
Yep.
The epiglottis has a big portion of that too. And the epiglottis and the soft palate kind of work hand in hand, and the soft palate should overlap the epiglottis just a little bit, millimeter or two, depending on the dog.
And the epiglottis, for those of you who aren't sciencey people, that's the thing that opens and closes when you swallow. Like you almost kind of feel it when you swallow. You'll feel like this pinch happen in the back of your throat in a way, and that's your epiglottis opening and closing.
Yeah, it's basically a flap that comes up and shuts the trachea off.
Oh, right. Yeah.
So that the food has to go down the esophagus.
Yes, and then the soft palate overlapping is kind of just like a little seal, like
Yes.
yeah,
So,
of tissue.
and I've seen some of these where they'll have the soft palate. You know, like I said, it should just kind of go to the tip of the epiglottis, and it covers the tip, the whole epiglottis, and down into the trachea.
Yeah, those are brutal. Yeah, you'll go to intubate your brachycephalic dogs, and you'll just see the soft palate dangling down into the trachea. Like, no wonder this dog snores. Like, when you have, like, humans that snore, a lot of times that's what it is a soft palate vibrating back there.
Mm-hmm.
And so these dogs will be bad snorers. A lot of times they'll cough when they drink water. They'll kind of choke a bit because a little bit of water's trickling around that whole malfunction because the epiglottis can't completely close if there's tissue in it. And then on top of that, air can't move freely if there's tissue in the trachea. Like, this tissue should not be extending that far back.
Right.
So, elongated soft palate.
And we'll do surgery to fix those. I actually had one earlier this week.
Mm-hmm. There's laser, right?
It's I use electrocautery now.
Oh, yeah.
It seems to have, from what I've seen, I did use the laser for a number of years. I don't seem to get as much swelling with the electrocautery.
That makes sense,
And I can be a little more precise in there. And that may be,
Your
'cause I know
experience, yeah.
that's my experience. I know. Oh, it's been probably 12 years since I had the laser. I know they've made some laser upgrades quite a
fair.
bit. But just from my experience from the laser that was, I think it was an '07 model laser. I seem to get a lot more swelling then than I do now with the electrocautery. I don't know.
Damaging more tissue beside the incision site.
It is.
Potentially busting little cells open
It
and
is.
such. Edema.
Yeah, and I don't know why that would have been for certain in there, but it seems like I get better results now with the electrocautery. Part of that may be me, just experience.
Yeah, I mean, well, it's just like our stethoscopes, right? Like, I listen with my stethoscope to dogs all day long, and if I can't find my stethoscope and I have to use somebody else's, I'm like, I all of a sudden don't know how to do my job anymore. Like,
Right.
Like, I don't know what normal looks like. We had to, the same for my ultrasound, having to send the ultrasound off to the doctor because it's having some issues with the color flow, and had to bust out an old ultrasound, and I was like, how did I ever use this thing? But it was like second nature to me then.
Mm-hmm.
It's just, or like getting in somebody else's car and driving somebody else. There's nothing wrong with that car. It's just really weird to drive somebody else's.
Yeah.
Like, how do I turn on the windshield wipers? I'm already driving and it's raining, and now I just realized I need windshield wipers and I don't know where they are. That's what it's like.
It's just a new experience. You don't know what, everything's not just second nature of being able to utilize everything.
Mm-hmm. For sure.
Yeah,
But anyway, so for us then, you're using electrocautery and you're just kind of trimming that guy back a little bit so we don't have so much hanging down the wrong direction.
Yeah, I trim it back to try to get it pretty close to where it should be anatomically in there. And now, in part of it, the soft palate may actually be a normal size for what you would see in a normal dog.
But they just don't have a long of a roof and
They
mouth.
don't have enough mouth sticking out there to stretch it out.
Not enough face.
They just don't have, not enough face.
Yeah.
Um,
Muzzle in those guys is always just a loss too. Which
Yeah.
most of them don't need it, but the English bulldogs sometimes will, and they're tough to get a hold
yeah,
of.
sometimes they'll get a little grumpy.
They do get grumpy. They like it their way.
Mm-hmm.
I mean, who doesn't?
Yeah.
Yeah. But anyway, okay. So we trim back the soft palate sometimes. What else?
We'll trim back the soft palate. I had a fleeting thought there to finish that up. I don't remember. Oh, I know what it is. A lot of these guys in vet school, we call them Snorter Dwarfs. I
Never
have
heard that before.
no idea. I think that was our
Well,
class.
and to be fair, a lot of them are chondrodysplastic as well. So they've got these little short bodies, and their little short legs that are weird and stuff. Unlike the Dachshund, which is chondrodysplastic, and the Basset Hound, and they've got nose for days.
Yeah. But we would but you will almost always hear these guys snore.
Yeah.
I mean,
even awake.
I mean, just sitting
Yeah.
there on the couch beside you.
Yeah.
I mean, they're just snoring.
Yeah, I have an English bulldog that comes in. His name is Bear, and that dog gives me a heart attack every time he comes in because he roars like when he's breathing. He just sits there and rattles and roars, just says it like constantly the whole time. Like, are you gonna pass out? It's so stressful because I don't know. But apparently he breathes normal at home. I've seen the videos, but man.
And he gets excited.
And when he gets worked up, it's like that soft palate goes rattling, and then it gets inflammation because of the rattling, and then you have less airway, so there's more rattling and more swelling, and it's just so stressful.
Yes, it gets, and it's stressful on the dogs as well, just because they can't move as much air. But it gets really,
happy.
Yeah, but it gets probably a lot of times it actually gets more stressful on us trying to make sure that nothing negative happens to them while they're here.
No doubt. No doubt.
It gets a little rough.
Yeah.
But to carry on from the soft palate, the next portion of the airway that they will commonly have issues with, and this is not specific to the brachiocephalic dogs.
Wait, are you going to go to the trachea?
Uh-huh.
No, don't skip the everted saccules.
Oh, crap. Yeah, I forgot. Sorry.
Yeah, I could feel the movement too far back in the throat.
Yeah. Before we get to the trachea, kind of right there around the epiglottis still, they will have what we call everted saccules. And that's where, as Dr. Keith was talking about the negative pressure, that's where that come in. It's a little pouch in there that just has some tissue in there. I don't know exactly what
its original function is
supposed to be doing.
I don't know either. It's just there to cause trouble.
It's what it seems to do now.
Yeah, like spleens.
Mm-hmm. But that negative pressure will actually evert those. It's like a little pouch on the side of it's the back of the mouth, starting in the throat area. But it's a little
kind
pouch.
of the tonsilly section.
Yeah, pretty close to the tonsils, right behind them. But that negative pressure will just make them turn inside out.
Yeah, it's like turning your pockets of your jeans inside out.
Mm-hmm. Yeah, I mean,
and now they're just
concept.
floating around in the throat, causing more airway obstruction.
So now you start off with not enough room to move air, and now you put something else in there to even decrease your amount of air that you can move. And
you got more negative pressure.
And it just complicates the issues.
It's just a snowball.
And a lot of times, what I've seen is if we get, take care of if they have an Aries problem, the nose hole problem, take care of that. Take care of the elongated soft palate to where we decrease the amount of negative pressure that's in there. Those a lot of times seem to correct themselves.
They'll just kind of float back into their spots.
Yeah, it takes a little bit of time. After we do the surgery, we put them on steroids because we want to make sure we knock down every bit of inflammation we can, because we want the swelling to an absolute minimum there. Just because, like I said, there's not enough room to move air to start with. So you add more tissue in there, whether it be the everted saccules or the swelling. Now you're even decreasing that. So get them on the steroids, try to get everything settled down as fast as we can, allow all that area to open up, and be able to move as much air as we can.
Yep.
So sometimes we'll have to go back in and cut those out just because they won't correct themselves. That seems to be less and less of an issue.
I was going to say, I don't remember the last time you had to do that.
We weren't open very long here the last time I had to do it.
I was going to say,
it's probably been
close
10
to a
years.
decade. Yeah.
Yeah, nine, at least 9 years for sure.
Whereas in areas in the soft palates, you're doing, a dozen a year, maybe more.
It depends on the year. Anywhere from it probably averages close to that. Some years, may only do 5 or 6, and then some years maybe 18 or 20.
Yeah.
So, but yeah, probably average one a month.
It's definitely
roughly.
routine-ish.
Yeah.
Yeah.
Yeah. So it seemed like that those saccules will, when we correct everything else, get all that negative pressure off of them. That many times they'll correct themselves.
Yeah.
In there.
Okay. So now.
Now we'll go to the trachea, the hypoplastic trachea, which is a fancy term for saying that their trachea, which is their big airway, that goes on us. You can feel it. It goes from your neck down to your lungs. The big major branch of
When people say it went down the wrong tube.
That's
when
it.
When you cough, that's the tube.
That's the tube. And all hypoplastic means is it's smaller than it's supposed to be.
Yeah, so plasia means development, and hypo means low or small or less. So you got less trachea that grew.
Yeah, so back to your straw analogy. Your milkshake straw is big. I mean, that's the straw everybody wants. Well, now you're breathing through the coffee straw.
Yeah, it's basically, it's like you put like a Chihuahua straw in a bulldog. Is really what's happening. It's too small for the size of lungs and dog and tissue to move enough air comfortably.
Yeah.
So.
Yeah, and I never thought about the straws. I always use the water hose analogy.
Yeah.
Like you've got a regular garden hose in there in a place that you need a fire hose.
Yeah.
And you got to move the same amount of water that you would through the fire hose, but you can only go through the garden hose.
Yeah. So you got a lot of pressure.
You got a lot of pressure, and then it can cause a lot of problems.
Pulmonary hypertension and.
Yeah, that garden hose, when you're putting the pressure and the volume through that you would a fire hose, is going to have problems.
Yeah. Yeah. I always think it's interesting. So, for those of you who have never seen like surgery or anesthesia, essentially when we are putting patients under anesthesia, we're intubating them, which is like a trach tube. If I don't know if you've probably experienced or seen someone or heard about it or watched enough medical shows, you know what we're talking about, where there's a little tube that goes down the throat to establish a patent airway. Well, in dogs and cats, it's imperative that you remove that tube at the proper time so that they don't start freaking out that it's in their throat. They'll start chewing on it, or they'll try to, bite down, or they're coughing, or those kinds of things. But not a bulldog.
Mm-mm.
Bulldogs will sit up in their cage and look you dead in the eye with their tube in, like, can I get one of these to go, please? This is the best I've ever breathed in my whole life. I'd like one to go home. And they'll just sit there, cool as a cucumber, breathing through this tube.
Yeah, it's amazing.
Yeah.
Most animals, and like most humans, as we start waking up, we're like, we got a tube in our mouth. It needs to come out. Like something's way wrong. And it seems to be mostly English bulldogs.
Yeah, it doesn't happen as much with like the Frenchies or
but the English
pugs.
bulldogs, see them, they'll just be sitting there and they'll lay on their side, as we're getting them through recovery. And then you see them, their eyes will just start looking around and everything. And, a lot of times we'll kind of wait on the cough, and I think they do that the same on the human side.
Yeah, to make sure that you've got your reflexes established to protect your own airway is the thought behind that.
Yeah, and we do the same. And so, when they start coughing, we know the reflexes are there. We can pull the trach tube, and they're going to be safe. They're not going to aspirate anything into the lungs. But these English bulldogs will look around, never cough, sit up, start walking around the cage with the tube in, and just sit there like, oh, thank you. Can I just keep this? This is part of the deal, right?
It's nuts, yeah. If only.
Yeah.
There's not really anything to do about that, because obviously they can't continue to have a tube in their throat. And, even like with things like collapsing tracheas, they've experimented with, ways to keep that airway more open, and the body rejects that eventually, even with the implants in the tracheas. I mean, you're looking at months maybe, certainly not long term. So as sort of in coughing dogs with collapsing trachea, which is a totally different set of dogs, doesn't have anything really to do with brachycephalics or hypoplastic trachea, but it's kind of last stages in stage treatment plan is those trach tube implants. So it's kind of a bummer. You got to pull it. There's not a great, if you're wondering why don't they just do that, it's because the body will reject it. Like the airway needs to have these little cilia, these little finger-like, hair-like projections all along our respiratory tracts that are constantly moving up mucus and cleaning the airway. Well, if you have something attached to the inside of this airway, then none of the cilia can move anything, and eventually that becomes not compatible with life.
Mm-hmm.
Massive inflammatory response.
Yes. One other thing that Dr. Keith alluded to that doesn't happen as much on the brachycephalics, but is that collapsing trachea. And I've seen a few of them and see them when, like, they're presented to us typically older in life. And they had the nares issues, they had the palate issues, they had the hypoplastic trachea, they had the everted saccules, and just over time, I think the first one, the one that I remember, I think was an 11-year-old English bulldog, and just breathing horribly, and had developed a collapsing trachea over that time. And I think my suspicion is just the years of all the negative pressure trying to get air in there just weakened that trachea enough and just wore it out where it was just starting to go down. So they can get it, but it's not as, there's many more breeds that it's way more common.
Oh yeah, like the Pomeranian, just waiting for it. Yorkies.
Yeah.
You better believe it. So what's happening in that, just to kind of finish that thought process out, is that essentially, like in our tracheas, you've probably seen pictures where there's these O-rings, almost like a dryer tube, if you will, or something like that, but just got these O's that run all the way down of cartilage that are stabilizing this airway. Well, in the dog, for whatever reason, instead of having O's, they have U's of cartilage. And so the circle of cartilage isn't complete at the top. And it's just this membrane kind of bridge across the top. And what will happen is as the top of that membrane gets weak or saggy because of time or just, increased pressure or chronic respiratory issues or whatever the thing is, just genetic predisposition, then that membrane starts to sag down and will occlude part of the airway. So instead of having this nice circle to breathe through, you're breathing through sort of a U in a way. And if they cough, if you ever had a dog with a collapsing trachea, you'll hear this kind of like smack sound. And when they're breathing or when they cough, because it's that membrane almost like smacking down on the bottom of the trachea, and then they'll cough and pop it open, and then the breathing goes on. But it gets a miserable situation for those dogs. So we work very hard to keep that cough at bay. Yeah,
and we try as best we can, because the old adage of, what was it, an ounce of prevention's worth a pound of cure?
Yeah, it is.
If we can find a lot of this stuff early, then you prevent a lot of the after effects. Even if collapsing trachea, if we can catch it early, we can kind of help it, not directly the collapsing trachea, but help what caused it in some instances to be able to not have it exacerbated.
Yeah. Slow down progression of disease based off an anatomical abnormality, which we bred for, which is unfortunate, but they're still great dogs.
They are.
So
they are. They just, they've got their set of issues.
Everybody does.
Yeah, so does everybody else.
All the breeds have their own unique thing. It's just the brachycephalics. Most of it's in the airway.
Most of it's in the airway. We'll change gears a little bit. Still stay around the head. One of the other big issues that we'll see with them is in the mouth. Still kind of part of the airway. Is they still have the same number of teeth as all your long-nosed dogs. You just have a whole lot less real estate to put them in. So what we'll see a lot of times is the jaws will not misalign, but you'll get maybe an elongated jaw. That's when you kind of see that bulldog has that
little shelf going on.
Little shelf down there. And it's just the body trying to adjust to the teeth that it doesn't have enough room to adjust to. In all actuality. And so on the upper jaw, a lot of times, those teeth, as they start growing in, all of the teeth start coming in. There's not enough room, so those teeth start turning sideways, and they get kind of jammed up with each other. And it just doesn't allow for the natural cleaning that you'll get from the saliva and whatnot in the mouth. And we'll run into dental disease in these guys a lot younger than, I won't say normal, but we see dental disease in these guys fairly
more than
often.
you would like a Labrador, for example.
Yeah,
they're not as bad though as little bitty dogs like Yorkies and Maltese. Those guys,
they're rough.
They struggle.
But you've got a 3-year-old pug. He's going to need some dental work at 3.
Yeah.
That lab, I've seen some labs that
never really need much help.
At 7 or 8, we're like, okay, we're starting to get a little plaque and tartar, so we need to go for a cleaning. But no, these guys, many of them by 3, we're needing to do some work. And we started to do a little bit of some preventative work, or try to be preventative. Proactive is probably more the proper term. Is get in there early in life when their adult teeth are in, kind of see how it's looking, and maybe preemptively remove a few of those teeth, just allow the rest of them to kind of straighten up and get back in more of a proper alignment of what we expect on your textbook dog mouth.
Mm-hmm.
Because if we can get to that, then their dental disease risk does go down.
Yeah.
And
they'll maintain the teeth they have much better as time goes on.
Right.
If they don't have that.
And then a little blurb about the dental disease. Why we want to get onto that is that bacteria that stays up in that plaque and tartar and whatnot around those teeth. If it breaks loose and gets in the body, there's a lot of physiology with that, but for lack of time, if it breaks loose and gets in the body, gets in the bloodstream, it likes to go set up housekeeping in the liver, in the kidneys and the heart.
Yeah, you will see it in the liver sometimes, but definitely heart and kidneys for sure. Dr. Goodall and I went into that in pretty good detail in our dental episode if you want to learn more about that. But it's a systemic problem. Like dental disease affects the whole body.
It does.
So it's painful,
Yeah, it is painful. I've had some dogs that, just wanted to chew everybody up coming in, and finally get them sedated, get them under, take our dental x-rays, pull all the teeth that we needed, come back in a couple weeks for a recheck. They're the nicest dog around now.
Yeah, now they don't hurt.
They don't hurt.
So they're happier.
So, we strayed a little off topic, but yeah, we're starting to do some preemptive stuff for the brachiocephalics just to try to help them out on their dental disease. And excuse me. As I said, there's a whole nother podcast on dental disease, so we won't go into that a whole lot further. But that's just another issue they have. One last kind of major issue that they'll have on the head. Everything's kind of smushed on the head, so their eye sockets are not as deep as everybody else's.
Yeah.
Their eyeballs, the globe itself, is
the same
size as the a comparative sized dog, but the socket that globe sits in isn't near as deep.
Yeah.
So their
eyes are more exposed.
Yeah, the eyes are more exposed. That's why they look kind of bug-eyed a lot of times.
Yeah.
Bulgy-eyed.
Because they are.
They
are. Less of the eyeball is in the skull.
Mm-hmm. Because there's just not as much skull to come around the eyeball.
Yep.
And then you get any inflammation or anything behind the eye, well, that pushes that eyeball out further. So now you're even less in what you have less of, so the eyes are sticking out even further.
Even more exposed.
So they're more exposed. And this will run into a couple of different things. It can. One is a proptost eye, which
been there.
Sounds a little gross, but that eye actually pops to the outside of the eyelids.
Yeah, so my story on that was whenever I was a first year, I just started my second year at vet school, so you don't actually have any technical skills. You just have learned a lot of sciencey stuff. And I was at my parents' house, and I had a 6-month-old Cavalier, which is why I make sure to mention that they're in the brachycephalic category. And she was, so 6 months old, and she would run around the house like crazy playing with my mom's dog, and she catches the corner of the coffee table just so, and pops her eye out. Which I think we may have actually talked about this in Dr. Dame's episode on blindness. But anyway, she pops her eye out. It sticks out 100 inches. That's how far it feels like when you're in that moment. But probably 2 inches. Straight forward. And I had a couple of my vet school friends there with me, and we're all semi-panicking, semi-trying to pretend like we know what's going on back then. And this kind of alludes to our emergency podcast, which would be 2 weeks before this one, I believe. And I have to call this because my parents lived out in the middle of nowhere. It was 20 minutes to the nearest town, an hour and a half to the nearest emergency clinic. But there's this vet on call, and he comes in and he's trying to get the eye pushed back in. And sometimes you can. I've saved many, many, many eyes, but especially pugs. Bostons. Their little eyes will pop out. You pop them right back in, close the eyelid for a little bit, week or two, and a lot of times you can save the eye. But if it's fully out.
Yeah.
Yeah. So Eliza lost her eye, and she was no worse for wear. She was a very happy camper her whole life. Did not Did not phase her a bit, and she had long hair, and she was a tricolor with black across her face, so a lot of times people wouldn't even notice she was missing an eye.
Yeah, no, you kind of had to know she was missing an eye to know she was missing an eye.
Yeah, exactly. But anyway, yeah, so they are more prone to the eyes popping partially or fully out.
Right.
If it gets too far out, it'll stretch the optic nerves and the muscles, and the eyes basically...
Yeah, I mean, if they get out too far, and it's going to give some measurements, but it depends on the dog and the size. Basically, that eye is non-visual at that point, just because it'll tear the optic nerve, and it doesn't heal. You're not getting any information to the brain. So now you have a body part that is not functional to you, not helpful. Mm-hmm. So it's just there and can cause problems. Mm-hmm. So at that point, we just remove them.
So you try to save them. Sometimes you do. Sometimes you have to nucleate.
Yeah.
So.
And then you'll have some that are kind of like, I don't know, maybe it's been out not too long and not too far, and you try to save it, and it ends up not working. We end up having to go in and nucleate. We've done that before.
We gave it our all, and sometimes you still just lose the eye.
Sometimes it just doesn't work.
But a lot of times you can save them.
And then there's some that walk in like, ooh, that's coming out right now.
Mm-hmm. Yes.
And then some will walk in.
Those are usually the dog fight ones.
Yeah, most of those are dog fights.
Yeah.
Oddly enough. And then you'll have some that'll come in, and you're like, oh yeah, that eye's good. We just got to pop the eyelids back over the front.
Yeah.
In there.
Get them on some anti-inflammatories, get that swelling
Shih Tzus are good about that one.
Yeah, Shih Tzus, yeah. We've done more than a few of those.
Yeah. Yeah, where it just looks like
I love Shih Tzus.
The eye just sets on the outside of the eyelids.
Yeah.
And you're like, if we can get to those early enough, we love those.
Pugs look like they're constantly got their eyes popped out of their sockets, but they're not.
No, they're not. But the pugs do lead into the other issue that we have with the bulgy-eyed, bug-eyed dogs, brachiocephalics, is that if you do get a little bit of inflammation or anything behind that eye, in general, normal everything's working. Those eyelids can barely cover the eyes.
Yeah.
And they just meet, and that's about all you can get out of them. And that keeps the eye moisturized and things like that.
Yeah, so they'll get essentially dryness on the surface of the eye, and then you'll get ulcers right smack dab center of the cornea.
Right in the center.
And they are so hard to heal because they're not staying lubricated. They're not getting all their healing bits and pieces. And so you have to work so hard on Shih Tzus, Pugs, Frenchies, all those boxers even are really bad about that. They're not as bulgy-eyed, but they are still technically brachycephalic. Mm-hmm. And those dogs, ulcers are a bear. Like, you have to see those dogs 2 to 3 times a week for a couple of weeks, and they can be a challenge.
Yeah.
I had one Frenchie. We had to do like 4 grid keratotomies on that eye before it would finally heal. And I was like calling the ophthalmologist that we referred to, and he's like, yeah, this is normal. Keep going. Okay, it doesn't feel normal anymore, but okay. No. We finally got it.
And part of that is the reason that the issue arises to start with, is that those eyelids can't completely cover and lubricate the eye because something happened.
Yeah.
And then your secondary effect of that is getting that ulcer. And if you don't get the primary issue resolved, or can't get it resolved,
you're right back where you started.
You're just spinning your wheels. You're kind of stuck in the mud.
Yeah.
And there, so
it can take some TLC on those guys for sure.
It does, and patience, a lot of patience.
Yes.
A lot of patience.
And cones, e-collars. Yeah, don't skip that part.
No, because that eye's bothersome.
Yeah, so they'll rub it.
They'll rub it and traumatize it more.
Yeah. Anyway, all right. Okay, so that's eyeballs.
That's eyeballs. Some of them we'll move to another little portion of the head is ears. Some of the brachiocephalics will have a more narrow ear canal than what you would expect for their size of head, which alludes to more ear infections.
Especially if they've got any allergies going on too, like the Frenchies. I think this is a great time to just say get insurance if you have a brachycephalic dog. Yes. Sorry, go ahead.
When they come in for their first puppy vaccine at 8 weeks, sign up for the insurance then. You can thank us later.
Yeah, that'll be maybe the last time your dog doesn't have a pre-existing condition.
Yes. That is true on these guys.
Yeah.
And that was in an article I read last night. I'm just trying to prepare for the podcast today, and I've never seemed to correlate that. But then as I was reading the article, I'm like, yeah, it does feel that way.
Yeah, pugs are that way. I mean, not all of them. So, like, Shih Tzus are not like that. But pugs are. I don't feel like Bostons are. Frenchies are.
Frenchies are.
So there's kind of hit and miss in there.
There is. And it seems like a lot of these guys are more prone to allergies. So you get the irritation and the swelling.
Yeah.
And which will even make that ear canal more narrow.
Mm-hmm.
So... I don't know. I don't know if I didn't.
Yeah, it's like a chicken or the egg at that point, Either way, you've got your problems. Either way, there's chicken for dinner.
Yeah.
Unless you're vegetarian.
Yeah, and I don't know if I didn't correlate it mentally in my mind just because we see so many ear issues.
Yeah, I mean, and I definitely don't think they're the biggest ear problems.
No,
by any stretch. And so that kind of, whereas, when you got breathing problems, they take the top 10 positions on the breathing problem list.
Yeah, for sure. But yeah, I just thought that was kind of interesting myself.
Yeah.
Reading through there, I'm like, never thought of that, but I remember going back through the case. I'm like, yeah.
And sure enough, now that you think about it, so.
Yeah.
So I know we're getting low on time, but I did want to touch a little bit on their backs.
Yes, that's where I was going next.
Okay, good.
I've got two spots that I want to cover in there on the spine, basically the spine. These guys, a lot of times in that mid-back area, held properly, it's typically from like T8 to L4 in there. Their vertebrae don't always develop properly. We'll have what we call a hemivertebrae, which is not a fully developed vertebrae.
Hemi is like half, essentially,
yeah, I mean,
or partial.
As you're looking at the x-rays from the side, that should look like, the vertebrae should look like a square. Well, the hemivertebrae will look like a triangle with the point coming towards the bottom. And then you'll have some butterfly vertebrae in there, which
is not as good as it sounds. So cute.
It's not.
It's not cute.
It's not cute, because now I don't know what kind of shape that would. I mean, well, I guess a butterfly.
I mean, yeah,
it kind of narrows in the middle and widens at the top and bottom.
Yeah, so instead of losing the bottom corners, you're losing the middle.
Yeah, you lose the middle. And those are the two big ones that you see most.
Which just predisposes them to degenerative back diseases,
yes,
or ruptured discs or those kinds of things.
Yeah, it's the vertebrae itself made like that. Typically, in and of itself, is not an issue.
Mm-hmm.
It's you lose that. You don't completely lose it, but you don't have the proper supporting structure for the spinal cord.
Some lack of stability.
Yeah, it's not as stable, more easily damaged, just because everything's not right.
Mm-hmm.
So then it secondarily leads to, some spinal cord issues sometimes, generalized back issues in there. And, I mean, there's not really anything we can do for it.
Yeah.
Unfortunately, on those.
Yeah. I mean, keeping them from becoming obese is a really huge thing. Maintaining their body weight, keeping them active. So we've got strong muscles supporting the rest of the body. But surgically, it's not like you can replace the vertebrae. It is what it is.
Yeah, we can't go fix the problem. We can manage the problem.
Yeah, that's fair.
But we cannot fix that.
Yeah, that's fair.
And now sometimes you will get a disc issue.
And those are fixable.
And you can go in surgically and do some work with that. A disc issue that did rise because of some of these vertebral problems. We can fix the disc issue, still not fixing the vertebrae.
Yeah.
But, we manage them with several different ways. The exercises, make sure we control their weight. And then some pain medications as needed.
Laser therapy we use a lot for back issues,
yes.
which is super helpful.
It is. I'm wondering about the new drug for the injectable.
Oh, Librela?
Librela.
I don't know. I would think it would help for the pain because it's just blocking pain receptors. It's not like it's actually working on cartilage per se. So theoretically, one would think it would work, but I don't know they've done the studies on it yet. It's so new.
It's new. I didn't know, because that just popped in my mind. I'm like, would Librela work on these back dogs?
I don't know, but welcome to veterinary medicine. Every day we're figuring out answers to new questions we didn't know we had until today. And then you answer the question, and then you move on to the next question.
Mm-hmm.
And then 5 years later, they're like, hey, remember when we told you that the answer was this? We were wrong. It's this. Like, okay, cool.
Yeah.
Inspiring confidence all across veterinarians
Yes.
and their people they serve. Yes.
All the time.
All the time. So, anyway, yeah, it's a journey.
It is. So yeah, they have some vertebral issues that we can't fix. We can manage, and we go on. Now we go further back on the dog, and we get to the tail, which is the end of the vertebral column.
Yeah.
And
what tail?
Well, what tail? That screw tail.
That screw tail. The English bulldogs, most famously.
Oh, yeah.
Their little tail will like turn around and grow up back in like the wrong direction into the tissue, and those get painful. Like, think about an ingrown toenail, but like amplified times, I don't know, 200.
Yeah. Change that toenail
into a giant bone.
Yeah. Like
at your booty.
Yeah, I've seen some of these guys come in.
This is why bulldogs are grumpy. It's because their booty hurts.
Yes.
From their screw tail.
Yeah, I remember we had another one that come in and just, alerts on his account. He would bite, and he was just mean.
Yeah.
And finally got him in, got the owners convinced, let's do surgery on this tail. Like, he is having some major issues.
Because they get skin infections around it too, because there's...
And you can never get them cleared up.
Ow. Oh, I feel for those guys.
In there. And so finally we did, and like a month later, everything is healed up, doing good, and he's just coming in all happy now. Yeah.
To completely change his personality because he was no longer in pain all the time.
Yeah.
So, yeah, corkscrew tails, good times.
Yeah.
Also, like, back to insurance. When you get insurance, make sure your insurance company doesn't have breed exclusions, because they might, like, cover corkscrew tails on any breed but an English bulldog. And they might cover Nary's procedures on anything but a Frenchie or a Boston. And it's like, don't play with those people. There are companies out there who will treat whatever ails your dog regardless of their breed disposition.
Yes.
So just word to consider.
Yeah, so do your homework and make sure they don't have some breed exclusions in there.
Yeah.
And or at least excluding the breed that you're looking at.
Yeah, right.
Yeah. Because if you're looking at the little French Bulldog and they have a breed exclusion for a German Shepherd, okay.
It doesn't apply to you anymore,
right.
But it still is an interesting foundation that they're creating for their insurance policy that I don't love. There are better companies than that, in my opinion.
I agree. But
because
like
what other little asterisk do they have at the bottom of their policy at that point?
Yeah.
Anyway,
but
that's my tangent on insurance.
No, I agree. But like I said, at least at the minimum, make sure that they don't have an exclusion for what you're looking at.
Or your breed, yeah.
Ideally, they shouldn't have breed exclusions. We won't get on that soapbox.
No doubt. And the ACL, the cruciate, we did that cruciate talk not too long ago, and some of those policies will have an 18-month wait period. You have to have your policy in place for 18 months before they'll cover a cruciate repair.
Yeah, look at different companies.
Yeah, there's different ones out there that don't do that.
A lot of them do have a wait period for the cruciate. Because you can play with the dates and the numbers and
limp along.
And limp along.
Pun intended.
In there. But some of them, a month or two.
Yeah.
And that's viable, I think.
Yeah, I agree. But 18 months is ridiculous.
18 months is crazy.
Yeah.
So.
That's a lot. That's a long time in a dog's life.
That's a long time. I've seen both knees go out in that time frame.
100%.
Be walking perfectly fine today, and in 18 months, we've already done surgery on both knees.
Yeah. But that's a different podcast. We don't want to scare everybody too bad. Let's scare them one body system at a time.
Yeah.
Anyway,
all
right.
Let's get off the insurance because we'll be there for days.
Yeah, and we got to go. They're paging you already, just so you know.
Oh, okay.
Yeah, I have my ear in it, and
Dr.
Trussell
I didn't slow down long enough to put it in.
Yep. So, all right, what's your closing thoughts?
Closing thoughts is the little smush-faced dogs are all cute.
We love them.
We do love them. Do know that they do come with their own sets of issues. They're not alone in that. Every breed comes with their own set of issues.
Yeah.
This podcast was just to kind of make you abreast of what you're getting into.
Yeah, and Dr. Trussell surgically fixes a lot of these, so I felt like it was a good one for him.
Yeah, I do. Like I said, I had an Aries and palette this week. I don't want to say it, but I haven't had a corkscrew tail in a little while.
Yeah, I mean, it's
Which
been 8 months or
means-
so. We haven't done one since the tornado.
I know I haven't done one since we've been over here, so which means I'm probably going to have 3 next month.
Yeah. I'll keep an eye out for him.
Okay.
Get him sent your way.
Yeah, but just an informative deal about knowing what you're getting into. That way, when your veterinarian says, "Hey, this is what we're dealing with," oh yeah, I was kind of expecting that. I knew this was in the breed, so
Yeah.
so
I
we're-
mean, that's
we're
all.
okay.
It's a whole point of this podcast is just be aware of what you're up against so you can make good decisions as you go along
Right.
and not have to live in the school of hard knocks.
All right. I mean, you don't want to be in there, and I've used this analogy for years. I used to watch NASCAR races quite a bit, and I'm like, you're driving your little Ford Pinto, which some people may not even remember the Ford Pinto. If you don't look it up and get a lot of scares from that. I'm like, you can't go with your Ford Pinto and go plan to win on the Daytona 500.
Right.
It's just not going to happen.
Yeah.
So, if you know that from the start,
You
you're not
can
going to
adjust
take
your expectations.
Yeah, you're not going to take the Pinto to the Daytona. I
That's
mean,
right.
it's just not going to happen.
No.
So, but the little dirt track up here in Meeker, yeah, you can soup that Pinto up and go win something.
Especially if you're racing against other Pintos.
Right. So I mean, it just kind of channels your expectations.
Exactly.
And broadens your knowledge base to
Be
to
prepared
kind of know
for what
you're
you're up
prepared
against.
for.
Yeah. Absolutely. Well, thanks so much for your time today.
You're welcome.
All right. We'll talk to you guys later. Call us as always if you have questions. Text, email. If we are not your veterinarians, ask your veterinarian because that's what we're here for.
That's it.
Okay. All right. Bye, y'all.
All right, bye.